Medical disclaimer. This podcast is for educational and entertainment purposes only. I am not a doctor, and I am not giving medical advice. Peptides are research compounds, and laws and safety standards vary by location. Always speak with your surgeon, anesthesiologist, and licensed medical provider before using any supplement, peptide, medication, or injection, especially before or after surgery. Never take anything that could increase bleeding risk, interfere with anesthesia, delay healing, or raise infection risk. If you are preparing for surgery, follow your surgeon's instructions exactly. Welcome back to the Peptide Effect podcast. Today we are talking about one of the most important, most misunderstood, and honestly most high-stakes peptide topics there is. Peptides for before and after surgery. Because here is the thing. People get obsessed with fat loss peptides, muscle peptides, anti-aging peptides, glow peptides, and all of that. But when surgery is on the table, your priorities change instantly. At that point, it is not about getting shredded. It is not about a beach body. It is not even about biohacking. It is about one thing: healing safely, reducing complications, protecting your immune system, supporting tissue repair, keeping inflammation controlled, and making sure you do not do anything that makes your surgeon look at you like, why would you do that? Because surgery is controlled trauma. That is what it is. Even if it is cosmetic, even if it is minor, even if it is outpatient, your body is being cut, manipulated, stitched, cauterized, stapled, or repaired. And your immune system, your inflammation system, your clotting system, your nervous system, and your metabolic system all shift into a different gear. And if you add the wrong peptide at the wrong time, you can create serious problems. So today, we're going to talk about what peptides are commonly used for surgical preparation, what peptides are commonly used for post-op recovery, which peptides should usually be stopped before surgery, and how to think about timing. And I am also going to explain why some peptides that are amazing for fat loss or performance are actually not your friend when you are about to go under anesthesia. So, let's start with the most important concept. Before surgery, your goal is not speed. Your goal is stability. Your goal is to go into surgery with balanced inflammation, balanced blood sugar, stable blood pressure, good immune function, and good tissue integrity. After surgery, your goal becomes repair. That means collagen synthesis, angiogenesis, which is new blood vessel growth, immune regulation, pain control, swelling control, and protection against infection. So we are going to break this into two phases: pre-surgery support, post-surgery recovery. But first, we have to cover one thing. The number one rule with peptides and surgery. If you do not tell your surgeon what you are taking, you are playing with fire. And I mean that. Because surgeons do not just care about what you take orally. They care about anything that changes your bleeding risk, your clotting risk, your blood pressure, your blood sugar, your heart rate, and your immune system. They care about anything that could interact with anesthesia. They care about anything that could cause abnormal swelling. And they care about anything that could increase infection risk. So if you are using peptides, you need to be able to list them. And if you are injecting something, that is not a casual detail. That is a major medical detail. Now, let's talk about the most common surgeries people in the peptide community are preparing for. Cosmetic surgery, like tummy tucks, breast augmentation lifts, BBL, liposuction, facelifts. Orthopedic surgeries, like knee surgery, rotator cuff, tendon repairs. Dental surgeries, implants, bone grafting. General surgeries, gallbladder, hernia repairs, C-sections. And bariatric surgeries, like gastric bypass or sleeve. All of these surgeries have one thing in common: the body needs repair. But the risks can be different. Cosmetic surgery has high inflammation, high tissue trauma, and high clotting concerns. Orthopedic surgery involves tendons, ligaments, cartilage, and long recovery time. Dental surgery has a huge infection risk because of the mouth bacteria. And bariatric surgery has a big metabolic and nutrient absorption issue afterward. So peptides can be extremely helpful, but they have to be used correctly. Now, let's start with the pre-surgery phase. If you are planning surgery, the first thing you should be thinking is this: what should I stop? Not what should I start? Because the biggest danger is not missing a peptide. The biggest danger is taking something that increases bleeding risk or interferes with anesthesia. So let's talk about peptides that people often use for fat loss. GLP-1 peptides, semaglutide, tirzepatide, retatrutide, cagrilintide, and the GLP-1 and GIP combos. These peptides can be incredible for weight loss, blood sugar, appetite control, inflammation reduction, and metabolic health. But here's the problem. They slow gastric emptying. That means your stomach empties slower. And why does that matter for surgery? Because if you go under anesthesia and you vomit, you can aspirate. That means you can inhale stomach contents into your lungs. And aspiration can be deadly. So GLP-1 medications and GLP-1 peptides are often required to be stopped before surgery. Many surgeons want them stopped at least 1 week before. Some want 2 weeks. And some anesthesiologists are getting stricter and stricter. So if you are on GLP-1s, do not just guess. You need to ask the surgeon and anesthesia team, because they will often cancel surgery if you took it too close. Now, what about peptides like growth hormone secretagogues? Sermorelin, ipamorelin, CJC, 1295, tesamorelin. These peptides stimulate growth hormone release. They can support tissue repair and recovery long-term, but they can also influence blood sugar and water retention. So before surgery, some providers will have you stop them. Not necessarily because they are dangerous, but because the goal is to reduce variables. Some surgeons prefer you stop anything that affects glucose or fluid balance, especially if you are diabetic or borderline diabetic, because high blood sugar is one of the biggest predictors of poor wound healing and infection. So for many people, growth hormone peptides are better used after surgery rather than right before. Now, what about peptides like melanotan, MT2? People use it for tanning and libido. This is absolutely not a surgery peptide. Stop it. No reason to be on that during a surgical window. And another big category, stimulant peptides, like some nootropic stacks. Some people use peptides like C-Max or C-Link. These are more neurological peptides. They are not typically bleeding risk peptides, but they can affect mood, blood pressure, and stress response. So again, you need to treat surgery like a sterile environment. Keep it simple. Keep it stable. Now let's move into the peptides that actually make sense for surgical preparation. And the first one, the king of all surgery peptides, is BPC 157. BPC 157 stands for Body Protection Compound. It is one of the most talked about healing peptides in the world. And the reason it is popular is because it has a reputation for supporting tissue repair, tendon repair, gut healing, and inflammation reduction. People use it for injuries. They use it for surgery recovery. They use it for stomach ulcers. They use it for joint pain. Now, I want to be clear. BPC 157 is not FDA approved for medical use. But in the peptide world, it is basically considered one of the best options for healing support. BPC 157 is often used before surgery to prepare tissues and reduce baseline inflammation. And it is often used after surgery to accelerate healing. It is commonly used subcutaneously near the injury site, or used systemically. Now, a lot of people ask, should you stop BPC 157 before surgery? This is where you have to be careful, because some surgeons want you to stop everything. And if they tell you to stop, you stop. But BPC 157 is not typically known for increasing bleeding. It is more known for tissue protection and angiogenesis. So some people use it right up until surgery and then continue right after. But again, this depends on the provider and the type of surgery. If you are getting something like a major cosmetic procedure, you might want to pause everything for a few days before, just to avoid complications. But in general, BPC 157 is one of the main peptides people consider in surgical support. Now, let's talk about TB500. TB500 is related to thymosin beta-4. It is another healing peptide. This one is more associated with muscle repair, tendon repair, and reducing inflammation. It is often used in sports recovery and injury protocols. TB500 is commonly paired with BPC 157. because BPC is more localized repair and gut protection, while TB500 is more systemic tissue regeneration. Now, for surgery prep, TB500 can be useful for people who are going into orthopedic procedures or procedures involving major tissue trauma. However, TB500 is sometimes described as increasing angiogenesis, new blood vessel formation, which can be amazing for healing. But surgeons can be cautious about anything that changes tissue remodeling too aggressively. So it is usually considered more of a post-op peptide than a pre-op peptide. But some people do both. Now, the next peptide category that matters for surgery is immune peptides. And this is where Thymosin Alpha-1 comes in. Thymosin Alpha-1 is a peptide that is often discussed for immune modulation. It is not a stimulant. It is not a steroid. It is more like an immune regulator. It has been studied in different contexts for immune support. And why does that matter? Because surgery temporarily suppresses the immune system. And infections are one of the biggest surgical complications, especially if you have implants, especially if you have stitches, especially if you have drains, especially if you have diabetes. So Thymosin Alpha-1 is often used before surgery to optimize immune function and after surgery to support immune recovery. Now, I want you to understand the difference between immune boosting and immune regulating. If you are too inflammatory, healing can be messy. If you are too suppressed, infection risk rises. So the best approach is balanced immune support, not aggressive stimulation. And Thymosin Alpha-1 is often considered a peptide that helps regulate rather than overstimulate. Now, another peptide that comes up is KPV. KPV is a fragment of alpha-MSH. It is known for anti-inflammatory properties, especially in the gut. So if you're doing surgery that impacts digestion, like bariatric surgery, gallbladder surgery, abdominal surgery, or you have IBS, KPV can be helpful. And even if you are not doing gut surgery, the gut is heavily affected by anesthesia, antibiotics, and stress hormones. So KPV is one of those peptides that is not as famous as BPC, but it is very relevant. Now, another peptide that matters is GHK-Cu, copper peptide. This is a skin healing and collagen peptide. It is famous for skin regeneration, hair growth, wound healing, and anti-aging. Now, for surgery prep, GHK-Cu is interesting because it supports collagen remodeling. But you have to be careful. If you are having a cosmetic procedure, especially something like a facelift, blepharoplasty, or skin tightening surgery, you want to coordinate timing, because you do not want to interfere with the surgeon's intended healing pattern. However, post-op, once you are in the safe zone, GHK-Cu can be incredible for skin recovery and scar quality. A lot of people use it topically. Some use it injectable. But scar reduction is one of the main reasons it is discussed. Now, let's talk about the biggest overlooked thing in surgery prep: blood sugar control. If you want better healing, you want stable glucose, even if you are not diabetic, because glucose spikes increase inflammation. They impair collagen formation. They impair immune function. And they raise infection risk. So one of the best peptides for surgery prep is actually controlling insulin response. And that is where GLP-1s are a double-edged sword. They can improve glucose, but they also slow gastric emptying. So they might be helpful leading up to surgery, but then must be stopped at the proper time. Now, another overlooked part of surgery prep is sleep. Because if you do not sleep, your immune system tanks. Your cortisol rises. Inflammation rises. Pain tolerance drops. And recovery gets worse. So if someone is using peptides like DSIP, which is delta sleep-inducing peptide, they may use it to improve sleep quality. But again, you must be cautious because anesthesia is essentially controlled sedation. So you do not want to mix sedative compounds too close to surgery. But in the weeks leading up, improving sleep can be huge. Now, I want to talk about something important. People love to say, I'm going to start peptides 2 days before surgery. No, that is not how this works. If you are going to use peptides to improve your surgical outcome, the ideal timeline is usually weeks before. Because you want to improve baseline inflammation. You want to improve tissue health. You want to improve immune stability. And you want to reduce metabolic stress. So a good pre-surgery peptide strategy is often something like this. 4 to 6 weeks before surgery, you can focus on tissue health. BPC 157. Maybe Thymosin Alpha-1. Maybe KPV. And good nutrition. And hydration. And sleep. Then 2 weeks before surgery, you start reducing variables. Stop anything that affects clotting, blood pressure, heart rate, or sedation. Stop anything questionable. Stop anything that your surgeon has not approved. And then 1 week before surgery, you are basically in lockdown mode. You are focusing on hydration, electrolytes, protein, collagen support, and stable routine. Now, what about bleeding risk? This is where people mess up. They will take things like fish oil, high-dose vitamin E, aspirin, NSAIDs, and herbal supplements. And they forget that some peptides and supplements may also influence blood flow. So, in the pre-surgery period, the goal is to avoid anything that increases bleeding unless prescribed. And that includes a lot of natural stuff. So you need to treat your pre-surgery window like a sacred time. Now, let's move into the post-op phase. Because this is where peptides can shine. After surgery, your body is basically in a repair emergency. And the first phase of healing is inflammation. Inflammation is not always bad. It is necessary. Inflammation brings immune cells to the area. It cleans up damaged tissue. It begins the repair cascade. So you do not want to completely eliminate inflammation. But you also do not want uncontrolled inflammation. That is what causes swelling, pain, delayed healing, and scar tissue issues. So post-op peptides are often aimed at supporting repair while keeping inflammation balanced. And again, the number one post-op peptide people talk about is BPC 157. It is often used immediately after surgery, once the surgeon clears it. Some people start within 24 hours. Some wait a few days. Some wait until the incision looks stable. But BPC 157 is often considered the foundation. It is commonly used daily, for several weeks. And it is often used for abdominal surgeries, orthopedic surgeries, tendon repairs, and cosmetic surgery. Now, the second major peptide is TB500. This is often used weekly or a few times per week, depending on the protocol. And again, TB500 is more systemic. It is like telling your body, let's rebuild tissue. It can help with mobility recovery. It can help with soft tissue recovery. It can help with injury rehabilitation. So if someone has surgery on a knee, shoulder, hip, tendon, ligament, or muscle, TB500 becomes a big player. Now, another major peptide is Thymosin Alpha-1. Because post-op infection risk is real. Especially if you have drains. Especially if you have implants. Especially if you have diabetes. Especially if you have autoimmune disease. So Thymosin Alpha-1 can be a powerful supportive tool for immune regulation. Now, let's talk about pain. Pain is not just discomfort. Pain increases stress hormones. It increases cortisol. It increases inflammation. It decreases sleep. And sleep is where growth hormone is released. So, if you cannot sleep after surgery, healing slows down. So, post-op recovery is not just about peptides. It is about supporting sleep, hydration, protein intake, and mobility as allowed. But peptides can support this. Some people use DSIP post-op for sleep, but this should be discussed with a medical provider because you do not want respiratory suppression or medication interaction. Now, another peptide that matters after surgery is GHK-Cu, because scar quality matters, especially in cosmetic surgery, especially in abdominal surgery, especially in orthopedic surgery, where incisions can be large. GHK-Cu is used to support collagen remodeling and skin regeneration. Now, here's the truth about scars. Scars are not just about the skin. Scars are about the collagen matrix under the skin. And if you heal too aggressively, you can get thick scars. If you heal too slowly, you can get weak tissue. So the goal is balanced collagen remodeling. So GHK-Cu can be an option once the incision is closed and stable. Usually you do not want to put anything on a fresh incision unless your surgeon approves. Now, another peptide that is sometimes used post-op is thymosin beta for itself or TB500 as a fragment. Again, this is part of the tissue repair conversation. Now, what about growth hormone peptides? This is where people get excited, because growth hormone is anabolic. Growth hormone supports repair. Growth hormone supports collagen synthesis. Growth hormone supports fat metabolism. So peptides like sermorelin, CJC, 1295, and ipamorelin can absolutely be helpful after surgery. But timing matters, because right after surgery, your body is already inflamed and stressed. And you may have temporary insulin resistance from stress hormones. So growth hormone peptides can be helpful, but they can also raise blood sugar in some people. So if someone is diabetic or pre-diabetic, you need to monitor glucose. But generally, once you are past the immediate acute phase, adding a growth hormone secretagogue can support tissue repair and recovery. Now, another peptide category that matters after surgery is gut repair peptides. Because anesthesia, antibiotics, and pain medications can destroy gut motility. And if your gut motility is slow, you get constipation. If you get constipation, you strain. If you strain, you can increase abdominal pressure. If you increase abdominal pressure, you can damage incisions. So gut healing is part of surgical recovery. And BPC 157 is very popular here. KPV is also popular. Some people also use peptides like LL37, but that one comes with a lot of controversy because it is antimicrobial and can be harsh. So for most people, sticking to BPC, KPV, and immune regulation is safer. Now, let's talk about inflammation. Because swelling after surgery is normal, but excessive swelling can delay healing and cause pain. So peptides that reduce inflammation are often used. KPV, BPC 157, Thymosin Alpha-1. And some people even use peptides like ARA 290, which is derived from erythropoietin pathways, but again, that is a more advanced one. Most people do not need to go that deep. Now, another important topic. What about clotting risk? After surgery, especially major surgery, you are at risk for blood clots. Especially if you are immobilized. Especially if you have a history of clotting. Especially if you are overweight. Especially if you are on estrogen therapy. So you have to be careful with anything that affects blood vessels. Some peptides promote angiogenesis, which is healing blood vessel growth, but clotting is about coagulation. Those are different systems. Still, post-op is not the time to be experimenting with random compounds. If you're going to use peptides post-op, you want peptides that are known for healing support, not cardiovascular stimulation. Now, let's talk about surgery types and which peptides fit best. If you are doing orthopedic surgery like tendon repair, rotator cuff repair, knee reconstruction, or something like that, then the main peptides people discuss are BPC 157 and TB 500. These are the two big ones. Some people will add growth hormone secretagogues after the acute phase. Some people will add collagen support supplements. Some people will add GHK-Cu later for scar tissue. But the main healing pair is BPC and TB. Now, if you are doing abdominal surgery like tummy tuck, hernia repair, C-section, gallbladder surgery, bariatric surgery, then BPC 157 becomes the foundation. Because BPC has gut protective effects. It has tissue repair effects. It has inflammation balancing effects. And then KPV becomes very relevant. Because abdominal surgery can trigger inflammation in the gut and immune system. Now, for cosmetic surgery. People want fast healing and minimal bruising. But bruising is blood. Bruising is bleeding under the skin. So the best way to reduce bruising is not to take random peptides. It is to avoid blood-thinning supplements and follow post-op instructions. But after surgery, once you are stable, BPC 157 can help. TB 500 can help. And later, GHK-Cu can help with skin quality and scar healing. Now, if you're doing dental surgery, implants, or bone grafting, BPC 157 is often used. Because BPC has been discussed for connective tissue repair. And immune peptides like Thymosin Alpha-1 can help support immune stability. But dental surgery has a high bacterial load. So you must take infection prevention seriously. That means antibiotics if prescribed, proper mouth hygiene, and not messing around with experimental peptides unless your provider is aware. Now, here is another major topic. Should you inject peptides near surgical sites? This is tricky. Because after surgery you have incisions. You have drains. You have compromised tissue. You do not want to inject directly into infected areas. You do not want to inject too close to incisions unless you are trained and sterile, because you can introduce bacteria. So if someone is using BPC 157 after surgery, many people choose subcutaneous injection away from the incision, like abdomen fat away from the wound,
or thigh,
or glut, or they use systemic injection. The goal is to support healing without contaminating the surgical field, because infection is the #1 nightmare. Now, let's talk about the timeline for post-op peptide use. In the first 24 to 72 hours after surgery, your body is in shock mode.
Pain,
Swelling, anesthesia, clearing, blood pressure changes, nausea, sleep disruption, and you are often on medications, pain meds, antibiotics, anti-nausea meds, blood thinners sometimes. So this is not the time to add a bunch of peptides unless you are experienced and medically supervised. For most people, the safest approach is to wait until you are stable. Then start the basics. BPC 157. Maybe Thymosin Alpha-1. Maybe TB 500 depending on the surgery. Then once you are a week or two out and incisions are stable, you can consider adding growth hormone secretagogues. And once the incision is fully closed, you can consider scar-focused peptides like GHK-Cu. Now, I want to mention something. A lot of people want to use peptides because they want to heal faster. But the truth is, healing is not only chemical. Healing is mechanical. If you do not rest properly, peptides cannot fix stupidity. And I say that with love. If you are supposed to avoid lifting and you lift, you can tear internal stitches. If you are supposed to avoid stretching and you stretch, you can open an incision. If you are supposed to avoid certain movements and you ignore it, peptides will not save you. So peptides are supportive tools. They are not magic. Now let's talk about another big category. Stem cells. Exosomes.
PRP.
A lot of people put these in the same conversation as peptides, because they are all regenerative medicine. But these are very different. Stem cells and exosomes can influence immune response and tissue remodeling in powerful ways. And some people do use them after surgery. But those are advanced medical interventions and should be handled by professionals. For most people, peptides are a more accessible, lower-intensity option. But still, you must respect them. Now, let's talk about what peptides are commonly avoided before surgery. Anything that impacts appetite and gastric emptying. That includes GLP-1s. Anything that increases heart rate or blood pressure. Anything that causes fluid retention. Anything that increases insulin resistance. Anything that affects sedation. Anything that affects clotting. And anything that you are not sure about. So, if you are doing surgery, it is not the time to experiment with a new peptide for the first time. If you have never used it before, do not start it right before surgery. Because if you get a weird side effect, you will not know what is causing it. And if you get a rash, swelling, anxiety, high blood pressure, nausea, dizziness, or appetite changes, your surgeon is going to have a problem. Now, another major thing. People forget to stop supplements like high-dose curcumin, fish oil, and things that thin blood. And they do not realize bruising risk can go up. So, your surgeon usually gives you a list of things to stop. And you should follow it exactly. Now, let's talk about peptides for inflammation control after surgery. Because one of the worst feelings after surgery is swelling. Swelling makes you feel tight. Swelling makes you feel sore. Swelling makes you feel like something is wrong. But swelling is part of healing. So the goal is to reduce excessive swelling while still letting the body repair. BPC 157 is one of the best for this. KPV is another. Thymosin Alpha-1 can help regulate immune inflammation. And proper hydration and electrolytes help tremendously. Now, what about NAD+? NAD+ is a big one. People love NAD+ injections for energy, cellular repair, and mitochondrial function. But NAD+ can make some people feel flushed, nauseous, jittery, or uncomfortable. So NAD+ can be a great recovery support tool, but it may not be ideal immediately after surgery, especially if you are already nauseous. However, once you are stable, NAD+ can support mitochondrial repair and energy production, which may help overall recovery. So NAD+ is more of a later recovery add-on, not a day one peptide. Now, what about MoC? MoC is a mitochondrial peptide. People use it for metabolic health and endurance. It can improve insulin sensitivity in some cases. It can support mitochondrial function, but it can also be stimulating. So again, not necessarily immediate post-op. But later, when you are recovering and want to rebuild metabolic health, it can be useful. Now, what about AOD? 9604. AOD is a fat loss peptide. It is a fragment of growth hormone. AOD is often used for fat loss without the blood sugar impact of full growth hormone. But is it a surgery peptide? Not really. Could it be used later in recovery if someone wants to manage body composition?
Sure.
But immediate post-op is not the time to chase fat loss, because your body needs calories and protein to heal. And if you diet aggressively after surgery, healing can slow down. So the mindset has to shift. Post-op is not weight loss season. Post-op is repair season. Now, let's talk about something that people do not want to hear. Protein is more important than peptides. If you do not have enough protein, you cannot build collagen. If you cannot build collagen, your incision is weak. Your scars will be worse. Your muscle recovery will be worse. Your immune system will struggle. So if you're going to have surgery, you should be prioritizing protein before surgery and after surgery. And you should also prioritize micronutrients.
Zinc,
Vitamin C, vitamin A, copper, magnesium, and hydration. Now, peptides can support healing pathways, but they cannot build tissue out of nothing. Now, let's talk about the biggest post-op danger: infection. If you are using peptides post-op, you must be sterile. Clean hands, alcohol wipes, new needle, new syringe, no reusing anything, no touching the needle, no setting it down, no being casual. Because post-op, your immune system is already busy. And if you inject bacteria, you can cause an abscess. And if you cause an abscess near a surgical site, you can create a serious complication. So the post-op period is not the time for sloppy injections. Now let's talk about scar healing. Because people ask all the time what peptide helps scars. GHK-Cu is the big one. But also, proper collagen remodeling is influenced by growth hormone. So peptides like sermorelin and ipamorelin may help. But again, timing matters. You want to make sure the incision is closed and stable. And topical care is huge. Silicone scar sheets, proper moisturization, and avoiding sun exposure. Because sun exposure can permanently darken scars. So, if you are using peptides for scar improvement, do not forget basic scar management. Now, let's talk about a realistic example. Let's say someone is getting a tummy tuck. What might a reasonable peptide strategy look like? In the month leading up, they might use BPC 157 daily to reduce inflammation and support tissue health. They might use Thymosin Alpha-1 weekly to support immune stability. They might focus on protein intake and sleep. Then, 1 to 2 weeks before surgery, they might stop anything questionable, including GLP-1s if required, and any performance peptides. Then, after surgery, once stable, they might restart BPC 157. They might add TB 500 weekly. They might use Thymosin Alpha-1 if infection risk is a concern. Then, after incisions are closed, they might add GHK-Cu for scar quality. And later, after recovery, they might consider growth hormone secretagogues to help body composition and tissue rebuilding. That is a more logical approach, not random chaos. Now, let's take another example. Someone is having knee surgery. They're getting a meniscus repair, or ligament repair, or tendon reconstruction. In that case, BPC 157 and TB 500 are usually the main peptides people focus on. And the key is physical therapy. Because peptides can support repair, but physical therapy teaches the tissue how to function again. And without proper rehab, scar tissue forms incorrectly. Mobility is limited. Pain becomes chronic. So peptides should be used alongside physical therapy, not instead of it. Now, another important topic: autoimmune conditions. If someone has MS, lupus, rheumatoid arthritis, Crohn's, or any autoimmune disease, surgery can be a major trigger. The immune system can flare. Inflammation can spike. So peptides like Thymosin Alpha-1 can be helpful. And peptides like GHK-Cu can help with inflammatory regulation. But these individuals should be especially cautious and coordinate with medical providers, because immune modulation is delicate. Now, what about post-op fatigue? That is very real. After surgery, people often feel depressed, tired, anxious, and emotionally unstable. This is not weakness. This is biology. Anesthesia affects neurotransmitters. Inflammation affects neurotransmitters. Pain meds affect neurotransmitters. And your body is spending massive energy repairing tissue. So peptides like Cmax and C-Link come up in this conversation because they are used for mood support and cognitive support. But again, if you are on pain meds or sedatives, you need to be cautious, because the goal is to avoid interactions. But once you are stable, peptides like Cmax or C-Link can be considered as supportive tools for mental clarity and stress resilience. Now, I want to talk about one more category: cartilage peptides, like Cartilax. These are sometimes used for joint support, but these are not acute surgery peptides. These are more long-term recovery peptides. So if someone is doing orthopedic surgery, cartilage peptides might come later, not immediately. Now, another big question. Can peptides replace antibiotics?
No.
Absolutely not. If your surgeon prescribes antibiotics, you take them. Peptides are supportive. They do not replace medical treatment. Now, can peptides replace pain meds? Not usually. Some peptides can reduce inflammation and pain indirectly. But post-op pain is real, and pain control is part of healing. So the best approach is to use pain meds as prescribed, avoid overuse, and focus on recovery. Now, let's talk about the biggest mistake people make. They try to heal too fast. They want to rush. They want to be back to the gym. They want to be back to normal. But healing has phases. Inflammation phase, proliferation phase, remodeling phase, and remodeling can last months. So peptides can accelerate healing, but they cannot bypass biology. If you rush, you can end up with adhesions, bad scars, chronic pain, or reopened incisions. So the best surgical peptide strategy is patience. Now, let's talk about practical timing recommendations. In general, many people consider stopping most peptides 5 to 14 days before surgery, depending on the peptide and the surgeon's guidance. GLP-1s are often stopped at least 1 week before, sometimes longer. Blood-thinning supplements are often stopped 1 to 2 weeks before. After surgery, many people wait until they are stable, incisions are clean, and swelling is under control, then restart healing peptides, often within a few days to a week. But again, this depends on surgery type. Now, let's talk about dosage mindset, because people love asking, how much BPC should I take after surgery? And while there are common dosing ranges used in the peptide community, the truth is, your dose depends on your body size, your surgery, your tolerance, and your provider's recommendations. But what matters more is consistency. Healing peptides are not one and done. They work best with steady use. So rather than chasing high doses, a consistent daily approach is usually what people do. Now, another important thing: hydration. If you are dehydrated, your blood is thicker. Your swelling is worse. Your constipation is worse. Your healing is slower. So if you want your peptides to work, you need water and electrolytes. Because post-op swelling is not just inflammation. It is fluid imbalance. Now, another critical topic: mobility. After surgery, you are often told to walk, not exercise. Walk. Because walking reduces clot risk. Walking improves circulation. Walking improves lymph drainage. And peptides that support healing work better when circulation is good. Now, let's talk about lymphatic drainage. After cosmetic surgery, lymphatic massage is often recommended. And peptides like BPC 157 may support tissue repair, but lymphatic drainage is mechanical. So if you are swollen, do not assume more peptides is the answer. Sometimes the answer is gentle movement, compression garments, and lymphatic support. Now, let's talk about appetite after surgery. A lot of people lose appetite, and that can be dangerous because you need protein, you need calories, you need nutrients. So if you are using appetite-suppressing peptides like GLP-1s right after surgery, that can make it harder to eat enough to heal. So again, post-op is not the time to aggressively suppress appetite, unless you are medically supervised. Now, what about anti-aging peptides like epithalon? This one is interesting. Epithalon is used in longevity protocols, but it is not really a surgical peptide. It might support recovery indirectly by supporting cellular regulation, but it is not a primary tool for wound healing. So it is something you would do later, not during acute surgery recovery. Now, let's talk about the simplest post-op peptide stack. If someone asked me, what is the most basic surgical recovery peptide plan people talk about, it would be this. BPC 157, TB 500, and Thymosin Alpha-1. That is the classic trio. And then later, GHK-Cu for scars, and maybe growth hormone secretagogues once stable. Now, I want to mention something. There is a reason these peptides are popular. They address the main pillars of recovery: tissue repair, inflammation regulation, immune support, and skin remodeling. So, if someone is going to choose peptides for surgery, those are the ones that come up again and again. Now, let's talk about red flags. If you are post-op and you have increasing redness, heat, swelling, pus, fever, chills, or severe pain, do not inject more peptides. Do not try to biohack an infection. You go to the doctor. You call the surgeon. Because infection is not a wait-and-see situation. Now, another red flag. If you have shortness of breath, chest pain, calf swelling, or sudden dizziness, that could be a blood clot. That is an emergency. So, do not assume peptides will help. Get medical care. Now, let's talk about the emotional side. People do not expect how mentally hard surgery recovery can be, especially cosmetic surgery. Because you look swollen, you look bruised, you feel like you made a mistake,
You feel depressed.
this is extremely common. It is called post-op depression, and it can happen even if you are happy with your results. So peptides that support mood and nervous system regulation may have a place, but the best thing is patience and emotional support. And remembering that swelling can take weeks or months to settle. Now, I want to give you a mindset that will help. Think of surgery like a construction project. You do not remodel a house and expect it to look perfect on day 3. On day 3, it looks worse. It looks chaotic. It looks broken. Then slowly, it becomes beautiful. That is exactly how surgery works. So, do not judge your outcome too early. Now, let's talk about the difference between pre-op optimization and post-op regeneration. Pre-op optimization is about building reserves, protein reserves, immune reserves, sleep reserves, hydration reserves, nutrient reserves. Post-op regeneration is about using those reserves to rebuild tissue. So the best peptide strategy is one that supports reserves first, then supports rebuilding after. Now, another question. Should you take peptides the day of surgery? Almost always no, unless your surgeon specifically allows it. The day of surgery, you want your body clean and predictable. No unknown variables. No stimulants. No experimental compounds. Now, what about the day after surgery? Again, this depends. Some people start BPC quickly. Some wait. But a safe approach is to focus on stability first. Pain controlled. Hydration good. No nausea. No infection signs. Then start. Now, let's talk about long-term recovery. Because healing does not stop when the stitches come out. Tissue remodeling can take 6 months.
A year.
Sometimes longer. So peptides like BPC 157 can be used in cycles. TB 500 can be used in cycles. Growth hormone peptides can be used in cycles. And scar peptides can be used over time. So do not assume you only need a week. If you want the best surgical recovery outcome, you treat it like a long game. Now, I want to mention something about post-op body composition. A lot of people gain weight after surgery. Not fat necessarily, but water weight, swelling, inflammation, constipation, reduced movement, So people panic. They think the surgery ruined them. But most of the time it is temporary. So do not rush into fat loss peptides right away. Give your body time to stabilize. Now, once you are healed, you can focus on body composition. That is when peptides like AOD, 9604, GLP-1s, or growth hormone secretagogues become relevant again. But not during acute recovery. Now, let's talk about scar tissue and adhesions. Adhesions are internal scar tissue bands that can form after abdominal surgery. They can cause pain. They can cause restricted movement. And they can cause long-term complications. So supporting tissue healing properly is important. This is where peptides like BPC 157 may help, but again, movement and physical therapy matter. Now, another overlooked area. Nerve healing. Some surgeries cause nerve irritation or nerve trauma. This is common in cosmetic surgery, orthopedic surgery, and dental surgery. So peptides that support nerve recovery can be useful. BPC 157 is sometimes discussed for nerve healing. Some people also use peptides like cerebrolizin, but that is a more advanced category and not a typical surgery peptide. So for most people, focus on the basics. Now, let's get into what I would call the safest surgical peptide principles. Number 1. Do not start new peptides right before surgery. Number 2. Stop GLP-1 type peptides according to anesthesia guidelines. Number 3. Avoid anything that increases bleeding risk. Number 4. Prioritize protein, sleep, hydration, and immune stability. Number 5. After surgery, start with healing peptides, not fat loss peptides. Number 6. Sterility is non-negotiable. Number 7. If something feels wrong, call the surgeon, not the peptide supplier. Now, let's talk about what a realistic conversation with a surgeon might look like. You might say, I take certain supplements and peptides for recovery. I want to make sure none of these increase bleeding risk or interfere with anesthesia. And then you list them. They might tell you to stop everything. That is common. And if they do, you stop. Because the surgeon's job is to keep you alive and complication-free, not to optimize your peptide cycle. Now, if you're someone who is deep in the peptide world, you might feel frustrated because you think you know more than the surgeon. But remember, the surgeon sees complications. They see infections. They see blood clots. They see wound dehiscence, which is when wounds open. So their caution is justified. Now, let's talk about the post-op timeline in a simple way. Week 1. Survival mode. Pain control. Hydration.
Rest.
Avoid infection. Gentle movement. Week 2. Swelling is still high. Bruising is fading. Energy is still low. Week 3 and 4. You start feeling more human. You start regaining mobility. Your appetite returns. Weeks 6 to 12. You start seeing real healing progress. Months 3 to 6. You see major changes. And that is why peptides can be helpful across that entire timeline, not just immediately after surgery. Now, I want to cover one more major topic. What about peptides that affect blood vessels? Some peptides, like PT-141, affect libido and blood flow. This is not a surgical recovery peptide. Avoid it during surgery windows, because the last thing you want is unpredictable cardiovascular effects. Now, what about peptides that increase appetite or cause nausea? That can be an issue too, because nausea after surgery is already common. So anything that increases nausea is a problem. So if you are using NAD+ and it makes you nauseous, do not do NAD+ right after surgery.
Wait.
Now, let's talk about the most underrated recovery tool. Breathing. Deep breathing. Post-op people tend to take shallow breaths because of pain. That can increase risk of lung issues. So deep breathing and walking are essential. And again, peptides are supportive, but oxygen is healing. Now, I want to bring this all together with a simple summary mindset. If you're going into surgery, your peptide strategy should be about protection and preparation. If you are coming out of surgery, your peptide strategy should be about repair and regulation, not stimulation, not extreme fat loss, not aggressive performance enhancement, just repair. Now, before we wrap up, I want to give you a realistic top peptide list that most people discuss in surgical recovery. BPC 157 for tissue repair, gut protection, and inflammation support. TB 500 for systemic healing and connective tissue support. Thymosin Alpha-1 for immune modulation and infection risk support. KPV for inflammation regulation, especially gut-related inflammation. GHK-Cu for skin regeneration and scar quality, usually later in recovery. And then growth hormone secretagogues like sermorelin, CJC, 1295, and ipamorelin for rebuilding, usually later, once stable. And if you're someone who is on GLP-1 peptides for metabolic health, those can be extremely useful for long-term weight and blood sugar management, but must be stopped appropriately before surgery and restarted only when cleared. Now, I want you to remember something. Surgery is one of those moments where the smartest biohack is not doing more. It is doing less. And doing it correctly. Because the body knows how to heal. Peptides just support the process. But you can absolutely sabotage the process if you get reckless. Medical disclaimer. This podcast is for educational and entertainment purposes only. I am not a doctor, and I am not giving medical advice. Always consult your surgeon and licensed medical provider before using peptides, supplements, or any injectable compound before or after surgery. Do not use anything that could interfere with anesthesia, increase bleeding risk, or increase infection risk. Follow your surgeon's instructions exactly. Thanks for listening, keep learning, and stay curious.